Hi everybody, so for my pathology presentation today, I'll be discussing C-Diff or Clostridium difficile colitis. I decided to discuss this because almost all of us are going into the healthcare field, more specifically nursing, and so I'm positive we will all run into this in our careers, probably more than we would like. So what is C. diff? According to the Mayo Clinic, C. diff is the inflammation of your colon due to a bacteria. This bacteria takes about 5 or 10 days to really develop, and we really see it in older people, so 65 and up. The reason for that is because when you put an older person on an antibiotic or a medication for a long period of time, the good bacteria that lives in our gut tends to die because of that. So that makes it really easy for the C. diff bacteria to house itself in their gastrointestinal tract and kind of take control from there. So with C. diff, as a nurse, the biggest thing to understand is transmission. This is where it's really going to affect you and how you do your job. The Center of Disease Control describes the transmission of C. diff as person to person through feces. So applying that to the real world, after you have cared for a patient or been around a patient with C. diff, the biggest thing you need to keep in mind is thoroughly using your protocol that your hospital or wherever you're working has given you, and especially washing your hands very, very well. The biggest thing I saw when I was researching transmission was washing hands. That is what the Center of Disease Control really emphasizes on, and that is the best way to prevent yourself from getting it. Also, your coworkers. So if you were to care for someone with C. diff and then turn around and not wash your hands and go touch things at like the nurse's station or other medical equipment, you're putting not only yourself at risk for being infected, but whoever's going to touch that medical equipment or whatever it is after you. So that kind of leads me to the signs and symptoms of C. diff. They go really along with the diagnosis itself. It's all pretty related to your gastrointestinal tract, your feces, stuff like that. So Mayo Clinic, the main signs and symptoms that they discuss are like bloating, blood in your stool, diarrhea, so really watery stool, a fever, anything above 99, and then pain. So pain in your stomach, your abdominal region. That's where you're going to experience it the most. So when we're looking at treatment for C. diff, I looked at Mayo Clinic and the Center of Disease Control, and both said antibiotic. So the first option that they're going to go is antibiotic. And the main antibiotic that I read that they were using is called vancomycin. I think that is how you pronounce it. So vancomycin, they're going to prescribe it to you, and usually that is going to take care of the bacteria. Now, if you have an extreme case of C. diff, I read that through the Mayo Clinic, they described the extreme cases. They usually start looking at a fecal transplant, or they start looking at surgery. But like I said, that was only discussed when looking at extreme cases. So typically you're going to be prescribed that antibiotic, and that'll be it. So I think that is all I have to say about C. diff. I hope you learned something and I made your discussion super easy. I hope I didn't make that hard for anybody, and have a great rest of your week.